Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in the lecture of striroga. Rather, the name of the subject is, that, Prasuti Tantra and striroga Vijnana. Paper 1 is of Prasuti Tantra and paper 2 is of striroga. So we are going ahead and ahead. We are, according to the syllabus, very important points are discussing, and we are discussing paper 1 since last many videos. Okay, so today is a continuation of the previous lecture. So everybody should open their notebooks, put the date as a 2nd of January 2024. I wish all the viewers happy, healthy, and prosperous New Year 2024. All the best. Okay. So we are continuing the topic Garbhastrava and Garbhapat. This topic is very important for the examination point of view as well as your practice. Today, we are going to see the last part of abortion, and fifth type of the abortion is missed abortion. Okay, so after missed abortion, just I will like to tell you which topics we are covering. So next topic will be septic abortion, infection, and then most important topic is RH, incompatibility and isoimmunization, that is related with the blood group and blood group of the mother and blood group of the child. What will happen? We will see at the last. First, we will start with the missed abortion. Okay, so clinical features. How we can say it is not a complete abortion, it is a missed abortion. Intrauterine dead fetus. Unfortunately, fetus is died in the uterus and retained passively in the uterine cavity. It is not aborted. Actually, whenever there is a dead something inside, it should be expelled out. But unfortunately, in this lady, that dead fetus is not aborted, and that's why the name is missed abortion. It is not expelled out. Okay. Again, as the lady is pregnant, so there should be history of amenorrhea, stopping of the menstrual cycle as usual, because she is pregnant and the child has been died, followed by the most important, vaginal bleeding, and that vaginal bleeding is brownish discharge. Most important, write down brownish discharge. This word is very important. And also spotting. Spotting means intermittent, little bleeding. Intermittent, little bleeding. But as the abortion is not started, there is not pain. Labor pain is not there. Otherwise, the child has been all expelled out, but it is not expelled. That is called as a missed abortion. What is the sign? You can see uterus size is smaller than gestational age. We are expecting, for example, the 4th month has been completed. So we are expecting this much height, this much organs should be there, but that is not there because the child is already dead. So uterine size definitely smaller than gestational age as per expectation. Bulky uterus because dead fetus is inside. Soft cervix. Internal os. See my cursor. Internal os is closed. That's why it is not expelled out. Inside is there. Spotting, bleeding from the cervical canal is brownish. Don't forget this word. Missed abortion, brownish discharge. Missed abortion, brownish discharge. Okay. Then pregnancy test, as it is already completed, no chance, so it may be negative. Ultrasonography is most important investigation. You do the sonography, you will get dead fetus is inside, no movement, nothing is there. Then serum fibrin degradation products that can be examined, bleeding time, clotting time, platelet count, this and that investigations can be done. Okay. Now, how to treat that missed abortion? First thing, if it is less than 3 months, then uterus is evacuated, taken out, evacuated. That is called as a dilatation and curettage. Dilatation and curettage. So D and C, that is called as a dilatation and curettage under antibiotic cover. Dilatation and curettage under antibiotic cover. That is most important, because this is a missed abortion, the fetus is died, so there are a lot of chances of infection. So always there should be antibiotic. Then this typical, what you can say, the hormone PGE1 intravaginally results in the spontaneous expulsion. So doctor is also trying that automatically should come out, that dead fetus inside. But if the pregnancy is more than 3 months, can you see the cursor? Please see, this is cursor, this is my cursor. Greater than 12 weeks, I will mark for you. My dear friends, don't worry, be happy. Marked here. Concentrate. Always remember, my friends, Dr. Deshpande is marking that para to make your attention. So you must attention. If the pregnancy is more than 3 months, then cervical ripening more matured with PG gel, prostaglandin gel, and 2-hourly injection of prostadine. Prostadine injection is given. That is a generic name. You forget about that. 15-methyl PGF2 alpha. Forget. You just remember this brand name, prostadine. Injection should be given. Why? We want that dead fetus should come out. Dead fetus inside? No, it's bad. That's why, because it is missed abortion, and we want to complete the abortion. Okay. Ensure. Here you can see next. Again, I will marks. We will not be hurry. Slowly. When there is, you are treating, here cursor, you see, missed abortion, ensure, be confirmed, complete evacuation. Everything should come out. Complete evacuation. Then, as there are chances of infection, give the injection tetanus toxoid, TT. Then, if the child may be little bit blood group negative, then anti-D gamma globulin to improve the immunity. Anti-D gamma globulin. And as there may be loss of blood loss is more, then you should start with the hematinic. What is hematinic? To increase the hemoglobin level. You can start give the injection after test dose, like Imperon, Jectofer, iron injections. Or if it is a too less hemoglobin, less than 6 g%, you can ask for blood transfusion also. We are discussing, my dear friends, the last part of abortion. You just see my previous video. It is related with the first 4 types of the abortion. Okay. We will go and see the further type of abortion, which is called recurrent. The lady will say, doctor, this is my 3rd pregnancy. Of course, she is not proud. So maybe her husband or relative will say, mother-in-law, etc. Doctor, my child, unfortunately, she had first 2 times abortion. Now this is the 3rd time. Doctor, please do something. Please do something. We want child. We want child. This is the 3rd pregnancy, doctor. What will happen? They are too much worried because the case is called as a recurrent, repeatedly abortion or habitual abortion. Try to understand. First pregnancy, abortion. Second pregnancy, abortion. Third pregnancy, abortion. Are you getting my point? This is called as a recurrent, again and again abortion, bad luck. But we must find out the cause. What is the cause? Okay. So spontaneous abortion, consecutively, continuous, 3 or more occasions means 3 or 4 pregnancies. She is always getting aborted. No chance of complete full-term baby by bad luck. It may be primary. That means what is, and it may be secondary. Try to understand. Primary means there is no complete full-term baby, not at all. That is primary. And secondary means there may be some another cause, or there may be some first one pregnancy full-term and then started the abortion. Okay. So we have to think what are the causes. There are different causes for that. Preconception stage. This particular, you see, investigation. We are talking about investigations in the recurrent habitual abortion. I will mark for you. My dear friends, see. Focus, concentrate. Preconception, that means before the lady is getting conceived male and female gamete. No, before that, you ask the patient to come do some investigation. Which investigation? Hemoglobin. Whether the lady is chronic anemic condition, see it. CBC, complete blood count. Is there any infections? WBC count is high. Lymphocytosis may be there. Blood grouping. Whether there is a RH incompatibility, she is positive, the child is negative, or she is negative and the child is positive. Basically, she is negative. That is a common. Mother is negative and the child is positive. That is RH incompatibility. Not matching. RH, rhesus. RH, rhesus factor. For example, my Deshpande's blood group is O positive. So O is the ABO system of blood group. And what is positive? RH positive or RH negative. Rhesus factor. Getting? So that rhesus factor in the mother, whether it may be A blood group, B blood group, AB blood group, O blood group, but that is negative, then there is a problem. If the child becomes the positive after conceived. Okay? So blood grouping is important, RH factor. Then karyotyping, is there any genetic problem? Then urine routine, is there any infection, chronic infection, kidney problem? Microscopic especially. Culture, very important. Culture and sensitivity, urine. Are there any organisms? Which antibiotic is the best? That is called as a culture and sensitivity test. Then GTT, glucose tolerance test. For diabetes mellitus type 2, fasting blood sugar, 30 minutes blood sugar, 60 minutes blood sugar, 90 minutes, 1.5 hour blood sugar and 2 hour blood sugar, 120 minutes. So this is called as a full GTT. Okay. Then liver test, liver function test, SGOT, SGPT, protein, renal function test, urea and creatinine, thyroid function test, T3, T4 and TSH, torch titer estimation. This is a separate topic. This is the infection. I will tell you afterward. But right now only, this is a group of infection. This time you just remember torch, TORCH, is a group of infection. I will discuss in some another time. Torch. Torch titer estimation, anti-phospholipid antibodies. These are the things that can get a problem with the pregnancy. So habitual abortion can take place. Human gonadotrophin, then cervical swab to rule out the listeria, bacterial vaginosis, chlamydial infection, and rule out this is the most common. In my practice, I have found many ladies with two problems. One is a torch and another is a cervical incompetency. Please write down. Cervical os is not proper tone. Its tone is not proper. Is not properly elastic. It's loose. And then as the cervical os is loose, whenever the pressure comes after 3-4 months, abortion. So cervical is what you can say, the mouth of uterus. Cervical os is the mouth of uterus, and that is not properly closed. Its muscle tone is not proper. So that is called as a cervical incompetency. And then the most important is doctor makes a stitch. Write down. Doctor makes a stitch, gynecologist. And that os is totally closed. Oh, so how the delivery takes place? Don't worry, my child. Till the delivery time, till the 9th month, the lady has to take complete bed rest. Complete bed rest. Only going to the toilet, eating, that's it. No other transport and all these things. No sex. Are you getting my point? So cervical incompetency, that means cervical os is loose. So doctor makes a stitch and advise complete bed rest and then give injection progesterone. Injection progesterone. Proluton depot. Proluton depot is the name of injection. This is very common, cervical incompetence. That's why Deshpande has given a lot of information. Okay. Then, whenever the pregnancy by chance starts, These all above tests are before getting the male and female gamete, before the intercourse, before getting the pregnancy. But after getting the pregnancy, routine antenatal checkup. My dear friends, I have the fantastic video already on YouTube, antenatal checkup. Please see. 2 or 3 videos are there. Antenatal checkup. 2 or 3 videos of Dr. Deshpande you must see. Best videos are there. Antenatal. During the 9 month, how doctor should do, in which month, what test should be done, etc. etc. Okay. Then torch test for the group of infection. Then anti-phospholipid antibodies, GTT, glucose tolerance test, ultrasonography, most easy test, non-invasive, and hormonal assay. You have to do the hormonal assay as well. Now we will go on this side. We are discussing this. Can you see my cursor, my dear friends, here? Recurrent habitual abortion. And now, what is the management? See, avoid sexual intercourse. No, not allowed. Complete bed rest. Adequate, not complete bed rest. Treatment of the particular cause. Cervical, in case of cervical incompetence, that is cervical circlage. That's the stitching. Cervical circlage in case of cervical incompetency. Low dose of ASA for anti-phospholipid syndrome. That is something complicated. I will explain afterwards. But you just write down anti-phospholipid syndrome. Okay. Then correction of the congenital anomaly. If there is a septum in the uterus, removal of the septum, surgery is required. Hormonal therapy for LPD, that is luteal phase defect. Luteal phase is under control of progesterone. There is a problem of the progesterone. That's why injection progesterone is given in the recurrent or habitual abortion. I think you have understood these all the abortion problems. And now I would like to go on the next page. Septic abortion. Oh my God. You know what is sepsis? Pus formation. In our hand, there may be some folliculitis, then boil, then abscess, then pus inside. You know this. That pus, when spreads through the blood, that becomes a problem for the lady. It's a very dangerous septic abortion. Infection with the abortion. Infection with the abortion. Septic abortion. Sepsis means pus. Sepsis is a serious condition resulting from the presence of harmful, can you see the cursor? Microorganisms, bacteria in the blood or other tissues, and the body's response to their presence, potentially leading to the malfunctioning of various organs. When the infection spreads to the blood, oh my God, that can affect liver failure, that can affect kidney failure. Oh my God, that is called as a multi-organ failure. Multi means many, multi-organ failure. This is the common. Forget about abortion, but in any case, whenever there is a septicemia, emia means blood, septicemia, the pus is spreading through the blood. Okay, so then brain will be damaged, and shock. Shock means less blood supply to the brain, and the brain functioning is totally hampered. That is called as a shock. And most of the times, very, very bad death can occur. But if very, very, very quick actions are taken, high doses and zabardast, strong antibiotics are given intravenous, then by chance something can happen better. Okay. Septic abortion is associated with sepsis of products of conception. For example, placenta, for example, umbilical cord. All these are the products of the pregnancy. So anything can get infected. The organisms are endogenous. It's not from outside, endogenous, from inside, from the patient's bowel, from lady, of course, pregnant lady, from the vaginal flora, from the endocervix, the infection go up to the uterus. Septic abortion is a very serious complication associated with high, can you see the cursor? Mortality. Mortality means death. Many ladies, unfortunate, bad luck, they die. Septic abortion is not मामूली नहीं है भैया, ये serious problem है. Cause it may be sometimes, God knows, spontaneous, may be missed abortion, may be incomplete abortion, may be criminal abortion. Do you know what is criminal abortion? Sometimes some illegal relationships takes place. Boyfriend, girlfriend, after 18, 19, 20, and they do some bad mischiefs, intercourse and all these things. Then she get pregnant. And then they both, boyfriend, girlfriend, they get afraid. Huh? They go to some fake doctor who is not very intellectual, ethical, having a lot of facility of sterilization. And they do whatever they have the instrument, they try to do abort. Because both girlfriend, boyfriend, they are afraid. What will happen? Our parents, what they will say, what society will say. Afterwards, they get, what you can say, the problem. And that is called as a criminal abortion. Illegal abortion have a high risk of contracting an infection and leading to the septic abortion. So be careful. Next. What are the organisms? We are talking about septic abortion. Okay, here. Step by step. First, marking, concentrating, discussion. Marking, concentration, discussion. This is the teaching style. Okay, organisms, polymicrobial. I am not saying that all you should remember. I will say you, for example, staphylococcus, very common. You can remember very easily. Then beta hemolytic streptococci. Hemolytic, you know the meaning of hemolytic? Blood cells are damaged. So hemolysis, streptococci. These are the aerobic, E. coli, very simple. Urinary tract infection is always with the E. coli. Okay. Then anaerobic, for example, you know the STD, sexually transmitted diseases. Husband has visited or the male partner has visited by chance with some prostitutes, girlfriend, then sexual workers, and then he get infected with gonorrhea, that is Neisseria gonorrhea or Clostridium. But Neisseria gonorrhea is a gonorrhea infection. And then it gives that gift to the wife, bad luck, very bad luck. And that can cause in the pregnancy this type of serious infections. Grade. How is more severity? For example, involve endometrium inside of the uterus and myometrium. Myo is always muscle. Myo is muscle. Involves the adnexy. Can you know what is adnexy? Central is the uterus, okay? And to the attached there is a fallopian tubes. You must be knowing. Then fimbria, and then the ovary. You know this. Centrally, for example, uterus, right and left fallopian tubes, fimbria, and the ovary. So the attachments to the uterus on the side, that is called, here you can see, adnexy. What is the word? Adnexy. What is adnexy? Fallopian tubes, fimbria, all these structures are called as adnexy. Pelvic structures, pelvic muscles, bones, okay? And generalized peritonitis. You know the meaning of peritoneum is a membrane covering the abdomen. So that may be get infected, okay? So we are talking about septic abortion. Don't forget what we are talking. Septic abortion. We are talking septic, very serious condition, septic. What are the symptoms? Pregnancy is there, so amenorrhea, no menstrual cycle, high fever, most important in septic. Whenever in the body, take a very simple example, my dear friends. To understand this, I will give another example. Suppose a person is a cough, okay? Cough is there. Little bit sore throat, pain in the throat, difficulty in deglutition. So that's to begin with. This is not related with the abortion. I am talking general, explaining you why the fever is indicating bacterial infection. When you start antibiotic, if the patient is only having dry cough, little bit body ache, sore throat, don't worry, be happy. But if he is having a lot of cough with mucus, and that mucus having yellow or the green color, and the most important is, oh my God, fever, high fever. Fever is always indicating, according to Ayurveda, indicating am. Write down, write down. Whenever there is fever, there is a possibility of am, toxin. And in the modern science, whenever there is a fever, it always indicates some infection. White blood cell count normally 4 to 10,000, but in infection, it goes up to 25,000 per cubic mm or 50,000 per cubic mm. Yes, that much high. WBC are soldiers of our body. Their count will be high in infection whenever there is a fever. But this fever is with chill and rigor. High fever. Fever with rigor, septic. Vomiting, because it is a toxic condition, diarrhea, loose motions, diffuse abdominal pain. Pain is there. Foul smelling. This is most important. Foul smelling vaginal discharge. Please write down. Foul smell indicates infection. Foul smelling vaginal discharge. It may be with pus, purulent, with vaginal bleeding. Red color will come out, blood. History of passage of products of conception. I have explained you. Products of conception, basically placenta, umbilical cord, fetal parts. These are the products of conception. Signs. What is the difference in symptom and signs? Symptoms, write down. Rugna samvedya lakshana. Rugna samvedya lakshana. That means the things who is experienced, which are mentioned by patient. And what is sign? Sign is always diagnosed by the doctor. Sign is always diagnosed by Vaidya, Samvedya, Lakshana. Ayurvedic terminology. Symptom, Rugna, Samvedya, Lakshana. Sign, Vaidya, Samvedya, Lakshana. Okay? Pallor will be there. Doctor will see, oh my God. How you can see pallor? Here. Just look here. My palpebral conjunctiva is pink, red, normal. But if it is totally white, that is called as a pale. You can see the nails, pale, not pink. So it indicating hemoglobin is less than 10 gram %. Normally 12 gram %. 12 to 14 gram, 15 gram, 16 gram, normal. But below 10 gram, below 7 gram, very dangerous. Sweating may be there. Pyrexia is a fever. Pyrexia is a fever. Tachycardia, pulse rate will be more than 90, 100, 110. Hypotension. Blood pressure, systolic blood pressure may be less than, write down, 80. Less than 60. That is hypotension. Delirium, abdominal tenderness, rigidity, guarding and distension of abdomen, soft cervix, soft and firm uterus, and internal os may be open. Okay? Now investigations. CBC, CBC, complete blood cell count. CBC, okay? RBC count, WBC count, neutrophil, eosinophil, basophil, lymphocyte, monocyte, etc. Urine analysis, physical examination, chemical examination, microscopic examination. High vaginal swab, urea, creatinine, electrolytes, sodium, potassium level, ultrasonography, radiograph of abdomen in case of peritonitis, because then there may be some gas under diaphragm like conditions. Chest X-ray in case of dyspnea or the breathlessness. Maybe there may be pleurisy. This can happen. Now we will go ahead. But before going ahead, as I am seeing lot of the investigations and examinations points of there, my dear friends, Professor Dr. Deshpande myself has created interesting mobile app. My YouTube channel is Ayurveda Academy. Everybody knows. Similarly, that app is also named Ayurveda Academy. Free to download, Google Play Store. You type it, Google Play Store, you go and say Ayurveda Academy, and automatically you will get that symbol and you download. Free download is there. Then there are minimum 10 to 11 programs. Nominal cost 200, 300, 400, 500. That's it. Only this much cost. And the most important is clinical examination. Nearly 15 interesting videos are there. Gynecological examination, pediatric examination, nervous system examination, respiratory system examination, heart examination, ENT examination. Oh my God, you check it. Very, very fantastic videos are there. Yes, PPTs are there. So you must take that program and learn how to examine the lady. Okay. We will go further, my dear friends. Now we will talk about criminal abortion. Criminal like police, huh? Police. Abortion, legally defined, is the premature, this is legal, mean official, premature expulsion of the fetus before the term of gestation is complete. 9 months, 9 days. Before that, if anything comes out, that is abortion. The law, Indian government law, does not differentiate abortion, miscarriage, and premature delivery. Criminal abortion is the most important word. You write down this: unlawful expulsion. Please write down this word in your notebook. Criminal abortion is equal to, write down, I will wait. Unlawful, it is not legal, it is not illegal, this is illegal. Please write down, illegal. Unlawful expulsion of the fetus by artificial means. It is a felony when any person advises, assists, or performs this abortion. He will be immediately behind the bar. Fake doctor, useless doctor who is doing these bad things, criminal abortion, he will be prisoned immediately. So take care. There are unauthentic centers are there, non-authentic centers in everywhere in India, even maybe in the foreign countries, I don't know. But criminal abortion is a serious offense. Try to understand. Next, opposite to the criminal is a medical abortion. These are opposite words. Criminal, unethical. Criminal, unlawful. Criminal, illegal. But medical, yes, legal, lawful. Medical abortion is a procedure that uses medication by the authentic doctor, intelligent doctor, experienced doctor. All the facilities are there. Uses the medication, medicines, or surgical intervention to end a pregnancy. A medical abortion does not necessarily require surgery or anesthesia and can be started either in a medical office, that means the hospital, or at home with follow-up visits. That is the most important. It is definitely safe and most effective during the first trimester of pregnancy. If there is a danger to the life of the mother, if there is a danger to the life of the fetus, there are some conditions where you can do official legal abortion, that is medical abortion. Okay, we will go further. Now here comes the next important examination topic. 100% this question is there in the examination. And what is that topic? RH, incompatibility and isoimmunization. Let us see, this is related with the blood group. First you understand this is related with the blood group. Okay. RH factor is a protein on red blood cells. Blood group is decided according to the antigen present on the RBC wall. For example, my blood group, I am giving you example, or your blood group is A. Okay, what does it mean by how it is decided? The RBC in your blood, having A antigen on the RBC wall, and in the blood, in the plasma, there are B antibodies. There are no A antibodies, because antigen is A. So that antibody should not be in the blood. Otherwise, what will happen? Antigen antibody fighting. Always antigen antibody fighting is there. So that's why when your blood group is A, you have the, for example, your blood group is Rh positive, sorry, A positive. Your blood group A positive. What does it mean? Your RBCs are having A antigen, number one, and also Rh antigen. That is here. This is a protein. Rh factor is a protein on red blood cell wall. Red blood cell wall. Rh incompatibility means not matching is when a mother has Rh negative blood and baby has Rh positive blood. This sentence is important. So I will wait, I will dictate, and you write down. Because this is the main sentence of the answer. What is Rh incompatibility? What is? Please write down. Rh incompatibility. You write down another word, mismatching, in the bracket. Incompatibility means mismatching, not matching. Like the ladies are always saying, whether my blouse is matching with the sari. So matching, and this is not matching. Incompatibility, not matching. Mother has, pregnant lady, mother is Rh negative blood. It may be A negative, it may be B negative, it may be AB negative, it may be O negative, but negative is important. And the baby inside has Rh positive. Any Rh positive, A positive, B positive, AB positive, or O positive. Here we are not concerned with the ABO system. That is not much important. What is important? Rh negative mother and Rh positive child. So I hope you have written this. Rh incompatibility mismatching means mother is Rh negative and baby is Rh positive. Next, Rh iso means self. Please write down. Iso means self. Immunization is, when does it take place? When the blood from the baby during the process of delivery. During the process of delivery, when we cut the umbilical cord, blood from the baby makes the mother's body to create antibodies. To create the antibodies, mother will create antibodies which can harm, which can be problem for the baby's blood cells. Are you getting my point? The mother will form antibodies and that will again mix with the baby, and then we'll be fighting Rh fighting, Rh positive negative fighting, or positive antigen antibody fighting, because antibodies will come again. But usually what happens, this doesn't problem for the first child. Even if mother is negative, child is positive, baby inside, first pregnancy takes place, by chance that first baby may get some jaundice, deep jaundice sometimes. But problem mainly arises when the lady is pregnant again. When the lady is pregnant again for the second chance. And that chance, if the baby is again, that baby is positive, already the mother has antibodies, they will mix with the child and there will be problem. But that will not happen because there is a treatment is available. Don't worry. Causes. This causes, the whole pathophysiology is very important. Baby's Rh status is inherited from the mother and father. That will decide the blood group. Okay. If the mother is Rh negative, forget about father. Mother is Rh negative and the father is positive, the baby has at least 50% chances of being Rh positive. Try to understand. The baby will Rh positive. RH isoimmunization can happen if the baby's RH positive blood enters the mother's blood flow. This may happen during, in case of, whenever these are the possibilities. One is miscarriage, another is a trauma, another cause may be ectopic pregnancy. What is ectopic pregnancy, sir? When the pregnancy is not taking place in the uterus, that what you can say, the gestational products or the whatever the pregnant development occurs outside the uterus. Outside the uterus. Try to understand. Then that is called as a ectopic pregnancy. Induced abortion, amniocentesis, or other pregnancy procedures. In all these things, there is a possibility that the child blood will enter into the mother's blood. The mixture of mixing fetal and maternal blood happens most often at the end of pregnancy. This means it is rarely a problem in the woman's first pregnancy. The first child will escape, no problem, no damage, nothing will happen for the first child. He will escape. He will be safe. The mother's antibodies, but mother has developed now antibodies, could affect a future pregnancy. When again she will pregnant, then there will be, the child will have problem. With a baby with RH positive blood, even if the blood is not mixed up, the mother can also become sensitized to RH positive blood if she has a blood transfusion of RH positive. Try to understand. During the pregnancy, by chance, forget about the child. If by chance the pregnant lady has very anemic and she is receiving some blood, and that blood is RH positive, then this situation also can occur, can happen. Okay. Next, concentrate, we will mark first. Okay. Here, the risk of RH incompatibility, mismatching, not matching with each other, not matching, is higher in RH negative pregnant woman who had a prior pregnancy with RH positive child, had second condition, prior blood transfusion or amniocentesis, did not get RH immunization, that is injection, during a prior pregnancy with a RH positive baby. Actually, whenever we see that the baby is RH positive, immediately pregnant woman should be given one RHD injection. And if that RHD injection is given, then she will not develop antibodies. Nothing to be worried. So there is a treatment is available, but that should be done by the gynecologist immediately. Okay. Symptoms. Symptoms will occur in the baby, remember, not in the mother. They can be mild, they can be severe. For example, the baby, the newborn baby, may develop hemolytic anemia. He will develop, the baby that is delivered will develop the hemolytic anemia. Excuse me. Then there may be jaundice, because again the hemolysis, bilirubin level will be high. Swelling of the body, which can lead to the heart failure or breathing problem in the child. Remember, all these symptoms we are talking in the child, not in the mother. Mother is doing that mixing. Mother is giving the antibodies, but child will suffer. Next, diagnosis. Blood test to find out whether the mother is RH positive, whether the mother is pregnant lady is RH negative. Then amniocentesis, you know, the amniotic fluid that is taken out and examined under microscope or test tubes to find out whether the baby has RH positive or negative. That we can decide. Okay. Next, this is the treatment. RH incompatibility. We are discussing RH incompatibility. RH mismatching. Mother is Rh negative. Mother Rh negative, not positive. Mother Rh negative. And child, yes, Rh positive. The goal of treatment is to keep the baby healthy and lower the risk of recurrence in the future pregnancies. We want that next child should also be comfortable. There should not be any problem with the present child and the next child. Rh incompatibility will be treated by giving, this sentence is very important, this is treatment. We are giving injection to the mother. Write down Rh immune globulin. This is the name of injection. It is also called as RHD. D is a capital. D is capital. Rh immune globulin to prevent Rh isoimmunization. Not all babies will need to be treated. Those who will need the treatment or who may need, some child may need medicines to improve the RBC production, that is erythropoiesis, because the whatever the RBCs are available, they are destructing. Transfusion to replace the blood cells, blood transfusion to the baby that are being destroyed, and early induction of labor. Sometimes to prevent the complication, the doctor will decide to do the cesarean section, CS. Okay. Next, prevention. Whether we can prevent this problem with the child. Rh incompatibility can be prevented. Yes, it can be prevented. What we do? We give the injection to the mother, not child. Rh immune globulin at the 28th week. What does it mean? 7th month. 7th month of the gestation means pregnancy. 7th month of pregnancy, you give the injection to the mother. A second injection again to the mother will be given within 3 days after delivery. 72 hours. 24, 24, 24. Within 3 days. Next, 2 injections should be given. The injections, what will happen? What is the benefit? Injection can block the mother's body from developing antibodies. She will not develop any antibodies. That is the most important benefit of giving this injection. So, my dear friends, today we have discussed 2 important topics. Second is more important, Rh incompatibility. This will be definitely asked in your written examination of Prasuti Tantra paper 1. And we have also discussed a lot about the different types of abortion, like septic abortion we discussed the criminal abortion, we discussed the ethical abortion, recurrent or habitual abortion, os tightening. I have mentioned that whenever there is a cervical incompetence, can you see habitual abortion? You remember cervical os is loose, bed rest, os tightening. That stitch will be there, os tightening. Okay. Then we have talk about the missed abortion. So, my dear friends, this is in short of the today's discussion, but there are still 7 minutes to go. So, please concentrate again. Dr. Deshpande will narrate with the audio 10 important topics, or 10 topics I can say, all are important. Prasuti Tantra paper 1. Prasuti Tantra paper 1. This is a revision all the time of the syllabus. First topic, Garbha Vijnaniya, fetus, Garbha Vijnaniya. The most important topic is, what is that? Write down SAQ, Garbhadhana, we have already discussed, video is there, Garbhadhana. Next, Garbhachi Masanumasik Vriddhi, development of the fetus month by month. We have taken, see the video. Next, Apara, placenta, we have taken it. See the video, Apara. Apara is equal to placenta. Next topic, Garbhodak, I have taken it. Garbhodak, amniotic fluid. Garbhodak, amniotic fluid. Second topic of paper 1, Garbhini Vijnani. First was Garbha Vijnani. Garbhini, pregnancy. Garbhini, pregnant lady. Most important topics, you know that. Vyakta Garbha Lakshanam. Garbhini Nidan Lakshana. How we diagnose that she is a pregnant lady. Garbhopaghatakar bhav, damage to the pregnancy. Garbhopaghatakar bhav, important. Garbhini paricharya, we have discussed antenatal care. Garbhini paricharya. Next, third topic from paper 1, Prasuti Tantra. Garbha vyapad. Vyapad is always complication. Garbha vyapad. There is garbhastrava, miscarriage, garbhapat that we have discussed. Then 4 important words. You open video. Upavishtak, upavishtak, nagodar, leenagarbha, and mrutagarbha. Complications. Upavishtak, nagodar, all are SAQs. Huh? Always 3 marks, 7 marks SAQ. Upavishtaka, describe Upavishtaka, describe Nagodara, describe Leenagarbha, describe Mrutagarbha. 4th topic, Prasuti Tantra paper 1, Garbhopadrava. Complications in the pregnancy, my video is already there. 2-3 videos are there. Garbhopadrava. What are the important? You know the pregnant ladies in morning. You know this? What is that? Chardi in Ayurveda. Garbhini Chardi. But modern name you remember? Very complicated name. Hyperemesis gravidarum. Sir. You see previous videos. Hyperemesis, HYPER. Hyperemesis gravidarum. Gravidarum is uterus. Because of the pregnancy, hyperemesis. उल्टिया मराठी मध्ये छर्दी उल्टी जैसा लगता है आती है उल्टी. Next is apasma, epileptic fits to the pregnant lady. Then also we have seen what else? Edema. We have also seen bahu apatyata. Multiple children are there. Anek apatyata. We have seen that. Garbhopadrava makkala. Very complicated and important one. Makkala. Write down. Makkala. Makkala. Next. Prasava Vijnana. During the process of delivery. Prasava. Then there is a Prasava Avastha. For example, Prajayini Avastha. Prajayini Avastha. Avi. Prasava Vedana. Labor pain. Prasava Vedana. Then Prasava Vyapad. Prasava Vyapad is a complication. Complication of delivery. Prasava is a delivery. Akala Prasava. Premature delivery. Akala. Kalatita Prasava. Kalatita after 10 months. Okay. Then Vilambita Prasava. Delayed type of delivery. Vilambita Prasava. Then there may be Garbha Sangha obstruction. Apara Sangha. Next topic. Topic 7. Sutika Vijnana. Sutika, after pregnancy, the lady is called as a, before pregnancy, Garbhini. After pregnancy, what is that word? Sutika. Sutika, perperial period, perperial. Sutika. I always recommend Balan Kada number 1. Do you want to write? Yes, write down. Medicines, important medicines after delivery. You can prescribe to your relatives and friends. Balanta Kada number 1. Are you writing? From the delivery date to the 10 days. I have the videos. Balan Kada number 1. First 10 days. 10 days to 1 month. Balanta Kada number 2. Yes, it is available. Balanta Kada number 2. After 1 month to 3 months. 1 month to 3 after pregnancy, delivery. Balanta Kada number 3. So Balan Kada number 1, Balan Kada number 2, Balan Kada number 3. 3 important medicines after delivery. Okay. So Sutika Paricharya, like Garbhini Paricharya, Sutika Paricharya. Then Sutika roga, diseases may happen. For example, again Sutika Jvara and Sutika Makkala. Makkala, very famous. For the oral, they will ask you. Topic 9. Moodagarbha. Moodagarbha. So there may be definition, there may be Nidana or Hetu, Samprapti. This will ask about the Moodagar. A total one question will be asked. Describe Moodagar in detail. LAQ for 15 marks. And last important topic from paper 1, Kutumba Niyojana, family planning. Two important operations, you know. Which operations? For the lady, we cut the fallopian tubes. You know that. Tubectomy, simple, write down, tubectomy. And in the male, vas deferens, surgeon cuts, vasectomy. Permanent, no child. Tubectomy, vasectomy. Tubectomy for ladies, vasectomy for the male partner, husband. And then OC pills, you know that. Oral contraceptive pills. For example, Mala D, M-A-L-A, Mala D is a name. So there are different methods of family planning, contraception, birth control, and one simple thing may be asked, Ayurvedokta Garbha Nirodh. Ayurvedokta Garbha Nirodh. Okay, so I hope that these are the important topics that are related with our paper 1. If I can get any easy reference, I will just try to add something in today's last 1 minute. For example, Upavishtaka. Please write down. There is still 1 or 2 minutes. Upavishtaka is equal to IUGR. Please write down. Intrauterine growth retardation. That is Upavishtaka. Upa Adhikavishtaka. That means to remain as it is, no development. Intrauterine growth retardation. Please write down. You can write down the references. Charak Sharirsthan, chapter 8. Charaka Sharirsthan, chapter 8. Please write down. Ashtangarude Sharirsthan, chapter 2. Ashtangarude Sharirsthan, chapter 2. Next, please write down. Nagodara. Nagodara is equal to Upashishka. Upashishka, very similar. Very similar. That means there is a stoppage of growth and also reducing that particular garbha becomes shishka, dried. Okay, no development, no heart sounds will be heard. So that condition is called as a nagodara or upashishka. Nagodara or upashishka. Okay. There is again reference Ashtangarude Vagbhat, Charak Sharirsthan, chapter number 8. Charak Ashtangarude Sharirsthan, chapter number 2. Then Leena Garbha. Please write down. Leena Garbha, Ashtanga Sangraha. There is no Ashtangarude. Ashtanga Sangraha Sharirsthan, chapter 4. Please write down. Leena Garbha. The fetus, when remains in the Garbhashaya or the uterus, leena. What is meant by sir leena? Please write down. Without any movement. Please write down. Without any movement. M-O-V-E-M. No movement. That is called as a leena garbha. Also, no heart sounds. FHS. No. FHS. No. And another is a mruta garbha. That is intrauterine death. Mruta garbha, intrauterine death of the fetus. Please write down the references. Charak Sharir, chapter 8. Charak Sharir, chapter 8 and Sushrut Nidan, chapter 8. Charak Sharir, chapter 8, Sushrut Nidan, chapter 8. Mruta garbha, intrauterine death. So I think in the last moment, I have discussed 4 words with you. Number 1, that is what are the complications? Upavishtaka, intrauterine growth retardation. Okay. Then Nagodara or Upashishka. Nagodara or Upashishka. That there is no fetal heart sounds. Actually, in Upavishtaka, there is a growth is retarded, but the FHS can be heard. FHS can be heard. This is the difference. in the Upavishtaka and Upashishka. Okay, in Upashishka or Nagoda, similar words, there is no hard sounds. And I have discussed Lina Garbha, no movement. Lina Garbha, no movement. Next time you tell me first. Mruta Garbha, intrauterine death. So my dear friends, this is 3 minutes after 8 o'clock. So this is the time to take the leave of you. I wish you all the best. Study hard. Also do the self-study. Because Dr. Deshpande's lectures will not be sufficient to cover the whole syllabus sometimes. So you have to study by yourself also and get confidence. Definitely will get, everybody will get the good marks. No problem. I wish all the best. Take care. See you tomorrow with the Bar Roga in the evening at 7 p.m. Thank you very much. Take care.